All right, welcome to another deep dive. This time we're looking into the world of medical surgical nursing.
Okay.
We've got some great interview questions and answers here that aspiring nurses might get. They come from interview prep.
Uh-huh.
We're going to dive into their 20 medical surgical nurse interview questions and answers
Good.
and see what we can learn about what it takes to be a great medical surgical nurse.
You know, it's funny you should say that because when most people think about hospitals, they think about nurses.
Yeah,
They're the ones you see the most, and they deal with such a huge range of medical conditions.
it's really true.
Everything from super sudden illnesses
Mm.
to stuff that people deal with for years and years.
It makes you realize how much they have to know off the top of their heads.
Right.
Our source talks about everything from cutting-edge new treatments to keeping track of all the different medications.
It's like they have to have this huge encyclopedia of medical knowledge in their brains.
It really is. And on top of that, they have to work with all the different specialists, too.
Oh, yeah, for sure. Doctors, lab technicians, physical therapists, the whole team.
So many people.
It's like a conductor leading an orchestra, making sure everyone's working together to help the patient as much as they can.
That's a great way to put it. And speaking of playing a crucial role, one of the questions that popped out was about assessing and monitoring vital signs. It's something we all kind of take for granted, but it's so much more than just routine checkups.
You're telling me.
Like, what's the big deal with those, right?
It's actually fascinating because it has a standard thing, but you have to be super observant to notice tiny changes.
Really?
Oh, yeah. And the source actually mentions this story. This nurse noticed a patient's blood pressure dip just a little bit.
Hmm.
Nobody else caught it but her. Turned out it was internal bleeding, and they were able to catch it early.
Wow.
And because of that, they saved the patient's life.
That is incredible.
I know, right?
It's almost like they have this intuition about their patients.
It really is. They have to be super observant and think critically about everything they're seeing.
I bet.
Got to connect the dots and then be able to make fast decisions based on that information.
Yeah, especially when it seems routine.
Exactly. That's the thing.
Now, I can only imagine how hard it must be to have those tough conversations with family members, especially when they're super worried about their loved ones.
You're not wrong.
How do they even begin to approach that?
Honestly, it takes real skill. You got to be able to explain complicated medical stuff clearly and with empathy, even when you're giving bad news.
Right.
It's almost like you're a diplomat or something,
Yeah.
navigating all these sensitive issues while staying professional.
That makes sense. And they're doing all of this while managing so many patients and a million tasks.
Oh, yeah, tons.
The source mentions documentation, and it hit me that paperwork's got to be more than just a formality for them.
Oh, it is. Good documentation is key. It's like a ship's log, Every detail is recorded super carefully.
I never thought of it like that.
It makes sure the whole care team's on the same page.
So it's like the official record that helps make sure things are consistent and helps prevent mistakes.
Exactly. Not only that, it can protect nurses legally. Like, imagine a patient says they weren't told about the risks of something,
Oh, I see.
but the nurse's notes show that they were told everything properly.
It makes sense.
So those notes are really important,
Yeah, a safety net for the patient, ain't the nurse.
for sure.
And while we're talking about safety, we can't skip over medication. Those questions really focused on getting that right because obviously
Right, the stakes are super high.
you can't mess that up.
Exactly.
So how do they make sure it's always done right?
It's really serious business. The source goes into how detailed it is. They double-check orders, verify the patient's info, make sure the dose is right, watch for any bad reactions. It's like a whole routine. Every step's got to be perfect.
And what's interesting is the source pointed out a common mistake, misreading the dosage on an order.
Oh, yeah, that's a big one.
Sounds simple enough, but if a decimal's off,
Yeah, that could be really bad.
huge consequences.
That's why they're trained to catch those things. They usually have another nurse double-check it, especially for high-risk meds.
It's incredible how much goes into something that seems so routine.
You have no idea.
And they're doing all of this while juggling tons of patients,
Oh,
all with different needs.
one of the big things about medical surgical nursing is multitasking. Imagine taking care of someone recovering from surgery while someone else just came in with chest pains.
Oh, God.
And you're still coordinating with all the doctors and specialists.
That's crazy.
Right, like an air traffic controller making sure all the planes land safely.
It's a perfect comparison.
And just like them, they have to constantly prioritize.
Yeah, who needs immediate attention?
Exactly. And whose needs can wait a bit.
These are split-second calls.
Sometimes literally life or death.
That brings us to another question about how they choose who comes first when everybody needs something.
That's a tough one.
It is.
It's like a constant triage They have to figure out how urgent things
No,
are. Not just vital signs, but pain, behavior, even just their gut feeling based on experience.
So sometimes the quietest patient might be the sickest?
It can happen.
The source gave an example where a patient didn't even complain of pain, that they were actually bleeding internally.
That's why you can't miss those subtle cues.
Oh.
Got to be like a detective.
Always looking for clues.
Right.
And what happens if a patient isn't getting better with the treatment?
That's when their real problem solving starts.
Yeah.
They got to figure out why it's not working, talk to the doctors, adjust the plan.
Sounds like a puzzle, always changing.
It is. And they need to be ready to change their approach.
It's all about thinking on your feet.
Absolutely.
And to do that effectively, they need to stay up to date.
Oh, yeah.
So the questions about continuing education are so important. How do they keep up in such a fast-changing field?
It really is constantly changing.
It is.
Got to be a lifelong learner, conferences, journals, online training, always learning new things.
The source really emphasizes that
Yeah.
medical surgical nursing is a fast-paced and ever-changing field.
So true.
So they're basically always students,
Basically.
eager to learn and grow.
That's the key.
But technical skills are only one part of it, right?
Right.
What makes a really great medical surgical nurse?
Oh, that's the real question.
That last one about what makes a great nurse, that was a great question.
It gets to the heart of it.
Yeah, what are those personal qualities?
Well, got to be calm under pressure, great communicator, totally dedicated to patient care.
And compassionate.
Of course. That human connection can make all the difference.
And speaking of the patient experience, I was really struck by that story about the nurse who went above and beyond for a lonely patient.
Yeah, what'd they do?
Took the time to sit with them, listen, brought them their favorite tea.
Huh.
It's not a medical thing, but it made the patient feel so much better.
It's those little things that show the human side of nursing.
Yeah.
Recognizing patients as people.
Not just illnesses.
Exactly.
It seems like they have this amazing ability to balance the technical with the human touch.
It's a balance for sure.
They do it so well.
It's true.
Well, we've covered a lot in this first part of our deep dive, but there's still so much more to explore.
Oh yeah, we've just scratched the surface.
We have.
We'll get into it all.
As we dig deeper into these questions, it really hits me that medical surgical nursing is all about teamwork.
Oh yeah, totally.
There's one here about working with all the different specialists, which makes sense.
Makes sense because these cases can be so complex.
They really can be.
It takes a village.
And the nurses are right at the center of it.
It really is a team effort. They're constantly working with doctors, pharmacists, therapists, social workers.
Wow, so many people.
It's like a well-oiled machine. Everyone's got their part to play.
And the nurse is kind of conducting it all.
Exactly. They're making sure everyone's working together smoothly.
There's actually a case study in here
Oh, tell me about it.
about a patient with a really complex heart condition.
Okay, yeah.
And the nurse was key to bringing the whole team together. The cardiologist, respiratory therapist, pharmacist.
So they could all come up with a plan.
Exactly. And the nurse's insights were crucial to that plan being a success.
Because they know the patient's day-to-day needs.
Right. And they're the ones communicating with everyone.
It's a perfect example of teamwork making all the difference.
It's not just working alongside each other. It's about good communication, respect.
Shared goal.
And speaking of communication, we can't forget about patient education.
Oh, super important.
There's a question here about how nurses explain things to their patients.
I bet that can be tricky.
Right, because medical jargon can be so confusing.
Especially when you're not feeling well.
Exactly, you're feeling vulnerable, overwhelmed.
So nurses need to be really good communicators.
Not just explaining things clearly, but addressing fears, making the patient feel empowered.
Absolutely.
The source mentions that some nurses will use visual aids.
Oh, like diagrams.
Yeah, diagrams or models. Some will break things down into smaller pieces.
I bet some even use humor.
They do. To lighten the mood and make people feel more at ease.
It's all about finding the right approach.
For each individual patient.
Exactly.
And sometimes that means having tougher conversations, like when a patient refuses to follow doctor's orders.
Oh yeah, what about non-compliance?
That's in here too.
It must be hard to deal with that.
It is, but the source stresses that it's about understanding the patient's reasons first.
Right, why aren't they following the plan?
Is it fear of side effects?
Do they not understand why it's important?
Maybe cultural or religious beliefs clashing with the treatment.
So it's like detective work again.
It is.
Got to figure out the root cause.
Once the nurse understands that, they can start working with the patient to find a solution.
Address their concerns.
Maybe suggest different treatments, talk to the pharmacist about adjusting doses.
Or just provide more education and support.
Exactly.
So many options.
And sometimes it's about advocating for the patient.
Oh, that's a good point.
There's a question about that, too.
Interesting.
Medical surgical nurses are often the ones who notice when a patient's needs aren't being met.
Or when their rights are being ignored.
Exactly. There's a powerful example in the source about a nurse advocating for a patient who was in a lot of pain,
Oh, wow.
but wasn't getting enough pain relief from the doctor.
That's awful.
The nurse kept pushing, speaking up for the patient until they finally got the help they needed.
That takes guts, especially when there's that hierarchy between nurses and doctors.
It does, but it all comes down to their ethical responsibility to advocate for their patients.
You have to put the patient first.
Absolutely. And speaking of ethical responsibility, we have to talk about preventing errors, especially with medication.
Oh, yeah. Can't mess that up.
The source goes into detail about how nurses minimize those risks.
Like what kind of stuff?
Double-checking doses, verifying orders with the doctor, staying updated on protocols and guidelines.
It's all about being extra careful.
It's not just about one person being careful, though.
Right. It's a team effort.
The whole healthcare team has to be focused on safety.
Everyone needs to feel comfortable speaking up if something seems wrong.
No matter what their position is.
That open communication can prevent little mistakes from becoming big problems.
And speaking of potentially stressful situations,
Yeah, there are a lot of those.
the source asks about how nurses handle the pressure and stay calm in those high-stakes moments.
Because it can be really intense.
These have-
Life or death situations, patients' conditions changing rapidly, worried families, so many demands all the time.
Sounds overwhelming.
It is, but medical surgical nurses manage to stay calm, focused. They have to.
Right.
The source mentions things like deep breathing,
Oh, yeah, that helps.
taking a moment to gather your thoughts.
And prioritizing tasks.
It's about finding that inner peace even when things are chaotic around you.
Like being the eye of the hurricane.
Yes.
Yeah.
And it's not just about managing their own stress. They have to project that calmness to their patients and families.
Because when you're the patient,
You're looking to the nurses for reassurance.
you need to feel like they're in control.
Exactly. It builds trust.
And that trust is built on more than just skills.
Right. There's a question about building rapport with patients. That's so important.
Tell me more about that.
It's about treating patients like people, not just cases.
Getting to know them.
Listening to their stories, showing empathy, making a connection.
It's like a partnership.
It is.
Working towards the same goal.
And sometimes that connection is as powerful as any medicine.
That's a great point. Now, we've talked a lot about teamwork and communication, but what about those moments where a nurse has to act fast to save a life?
Oh yeah, those are crucial.
There's a question in here about that.
Makes sense.
It highlights the importance of clinical judgment.
Knowing what to do and doing it quickly.
The source gives an example of a nurse who recognized the signs of heart attack.
Even though the patient wasn't complaining of chest pain.
Yeah, they weren't.
Wow, that's amazing.
The nurse called a code blue, started CPR, got the crash cart, all in seconds.
They saved that patient's life.
It's moments like that that really show you how much responsibility these nurses have.
They really do.
They're making life and death decisions every day.
It's true. And while they don't always have all the answers, they have the knowledge and the skills to face anything.
And the courage.
Oh yeah, tons of courage. And they're doing it all as part of a team.
Which isn't always easy.
No, not at all.
Even in the best teams, there can be conflict.
Absolutely.
How do they handle that?
There's a question about conflict resolution. And what's interesting is it's not about avoiding conflict. Because that's impossible.
Especially in such a high-pressure environment.
Right. It's about managing it constructively.
Finding solutions that benefit everyone.
Especially the patient.
Which takes a lot of communication and diplomacy.
The source talks about active listening.
Trying to see things from different perspectives.
Finding common ground.
Putting egos aside.
Remembering that everyone's there to help the patient.
And I bet having that shared purpose helps a lot.
Oh, absolutely. Knowing you're all working together to make a difference.
That's a powerful thing.
It's what medical surgical nurses do every day.
They're the unsung heroes.
Working tirelessly behind the scenes.
To make sure patients get the best care possible. And with that, we've come to the end of our deep dive into the world of medical surgical nursing.
It's been quite a journey.
It has. We've learned so much about this amazing profession. So as we wrap up looking at these interview questions, I'm really curious to hear your thoughts.
Yeah, me too.
What's really stuck out to you about medical surgical nursing?
Honestly, the thing that gets me is how much they have to know about everything.
It's true.
Like you said, it's one thing to specialize in cardiology or oncology,
Right. Just one area.
but
Yeah.
these nurses need to be ready for anything, any kind of condition, any treatment.
They're like the general practitioners of the hospital.
That's it.
And they have to be able to switch gears so fast.
Oh, constantly.
1 minute it's post-surgery care, the next it's a heart attack.
It never stops.
It really is a constant juggling act.
And they handle it so well. Remember those stories from the source material?
I do.
Staying calm under pressure, making tough calls, fighting for their patients. It's incredible.
It really is inspiring.
It makes you realize they're not just caregivers. They're problem solvers, educators, advocates.
Even detectives in a way.
Right. Always watching, assessing, figuring out the best way to approach each situation.
And we can't forget that human element.
No, that's huge.
The source talked a lot about building rapport with patients, showing empathy, establishing that trust.
It's so important.
Those connections can make all the difference.
Absolutely, for the patient's experience and even their recovery.
It takes nursing from a job to a calling.
It's a vocation.
And you can really see that in these interview answers.
You can tell they want to make a difference.
It's not just about the skills, it's about helping people.
Exactly. And what we've learned here,
Yeah,
it applies to more than just nursing.
that's true.
Critical thinking, communication, teamwork, resilience, staying calm under pressure.
Those are important everywhere.
No matter what you do, those skills are valuable.
It's like teachers, entrepreneurs, even parents at home.
It all comes back to those core skills.
And it makes you see the impact nurses have on the world.
It's bigger than just the hospital.
They're shaping future healthcare professionals, inspiring people with their dedication.
And as healthcare keeps changing,
It's always changing.
new technology, more focus on the patient,
The role of the nurse will be even more important.
without a doubt.
We've really only scratched the surface here.
We have.
But I hope this deep dive has given everyone a new appreciation for what medical surgical nurses do.
They really are amazing.
They are, so the next time you see a nurse,
Yeah,
remember they're not just a caregiver.
right.
They're highly skilled, compassionate, and truly dedicated to their patients.
Couldn't have said it better myself.
Thanks for joining us on this deep dive into the world of medical surgical nursing.
See you next time.